Hey everyone, and welcome back to What After Dentistry. Have you ever thought of amalgamating genetics into dentistry? Ever heard about the domain of dental genetics? No, right? So today we are basically going to discuss this very promising and very unconventional, unheard field of dental genetics after BDS or MDS. We're going to talk about the scope and the opportunities, how to get into this field, what all avenues open up if you want to pursue this field. And to discuss all this today, we have with us Dr. Gargi Roy Goswami, founder and director of the Indian Academy for Clinical and Dental Genetics, first of its kind academic endeavor in India to bridge the gap of knowledge between basic sciences and dental sciences. She is also the director of Cronias Private Limited, the first company in India to address the field of training and education focused primarily on dental genetics and saliva diagnostics. Kronos also offers content marketing services for small and medium businesses in the field of life sciences, dental companies, and medical device manufacturers. She is the pioneer in initiating the first and unique interdisciplinary platform of the International Saliva Symposium India, endorsed by the North American Saliva Symposium, that brings together academicians, researchers, and industry under one roof. She completed her BDS at Rajiv Gandhi University of Health Sciences, and since then she has been working extensively in the field of dental genetics. Prior to her BDS, she completed her postgraduate degree in applied genetics and had an extensive research at JNU New Delhi and IIT Kharagpur. Her research caters to oral cancer genetics, saliva diagnostics, and research. She has also authored a book titled COVID-19 Detection Strategies Swab to Saliva, which focuses on the current state of COVID-19 diagnostic methodologies, highlighting point of care tests that utilize saliva specimens as the testing matrix. She is passionate to revolutionize Indian dentistry and clinical sciences by fostering interdisciplinary scientific education through a conglomeration of genetics, genomics, biotechnology, molecular biology, and bioinformatics knowledge in clinical and dental sciences. Apart from her professional endeavors, she is a trained Kathak dancer, loves to paint on canvas and glass, and loves cooking. So let's hear what this field is all about and what the field looks like. Check it out. Hi, Dr. Gargi. Welcome you on our channel, What After Dentistry, to talk about this emerging field of dental genetics after BDS or MDS. I'm sure there's a lot to get unfold during our conversation today. So, welcome you once again.
Thank you, Dr. Shireen, for your kind invitation. And I think you are doing a great job through your channel. And I'm very happy to be here. Thank you once again.
Thank you so much. So, before we get into the formal discussion about the field, understanding what courses are available, what are the opportunities, and so on and so forth, I would like to know that how did you generate your interest towards this field? How did you get to know about the field of dental genetics?
Well, that's a very interesting question, and I would love to answer it. Yeah, this concept, I won't say that I have discovered it, but I think I have innovated it. That is in one line, I can say, I can answer your question when it comes like, how did I know it? Well, this field has been existing for long, but it has not been explored, particularly in this part of the world where, like India or Asian population, and it has not been spoken about in a very concrete way. So I just to extend my answer or give you a more perfect answer, I need to tell a little bit about my academics. Then I think your audience and you will also relate to it better and how exactly I came up with this concept of dental genetics as a field. Well, basically, I am a postgraduate in genetics and I had a thorough, intense research career. I worked in Jawaharlal Nehru University, that is JNU New Delhi. I was also associated as a project associate in IIT Kharagpur. And after that, I plunged in doing undergraduation in dentistry. So, well, when I did that, I saw that there is a lot of gap that was existing, and Shireen, I'd love to share this story when a question like this comes, because that is the beginning point of my passion and bringing this up as a field, particularly establishing it in India. So when actually I was into my research career, I used to work day in and day out into with and dealing every day with oral squamous cell carcinoma cells, because my expertise, I'm basically a molecular biologist, and my very niche area of expertise is oral cancer genetics. So that time I had no idea how dreadful oral cancer would be clinically, or how exactly the treatment aspect goes on, because at that point my field was didn't allow me, or it was not actually necessary for me. Then with after the time, after a long time, when I again just tried to tickle my neurons, and I thought, let me go back, pull my years age back in numbers, and I went and joined the young crowd, because all my batchmates were almost 10-15 years younger to me. So when I did my BDS, I again saw, I understood oral cancer in a more better way, theoretically, practically, learning about diagnostics and all stuff. But again, I saw there is a huge gap in understanding or bringing these two fields together. Um, as we all know that we have 9 branches in dentistry, particularly which I personally feel, you might disagree with me, and I respect that, that two of the most important branches when it comes to diagnostics is oral medicine, and when it goes to what relates directly to research is oral pathology. So I have seen people working, a lot of students working, they're doing their thesis, that involves molecular diagnostics or technologies, but I have seen that they really don't have the real idea what's going on or what exactly they're doing. They follow a direction that is given by their guides. Well, I'll be very straightforward in this, and I have been so through all these years. So that is the protocol that's going on. And suppose they take up a tissue, they take down DNA, or they do some stuff, molecular stuff in that, but most of the work is being outsourced, and they don't even have very preliminary ideas, where I want to say that ideas, when I say that, they don't know whether a report that is being sent from the lab is right or wrong, which I found is, it was very, very surprising to me, because you are earning a master degree, you are earning PhD degree, and you are not exactly into the core of the science. So from that was the inception when I thought, well, why can't we bring these two domains together? Nobody speaks of interdisciplinary science, and science by itself, by nature, it is interdisciplinary, and we need to accept it, and we need to understand it. So from therein, this concept came into my mind. To be very, very honest, true to the core of my heart, I had no idea that that time that such a field could exist. So when that idea came into my mind as dental genetics, I just went and searched in Google, and I was surprised to see that there was nothing as such as a domain, or like, as a specialty that is being spoken. Well, definitely there are small courses or advanced specialties, that too in the Western world, where they do workshops, or it might be small programs, workshop kind of programs, or small diplomas that they do, but still it's not very concrete. Like, I mean to say, if today a student wants to pursue that as a career, they need to start from scratch, and then go to that from A to B point. That is not there. So from that time, it flashed in my mind, and I left a very promising clinical practice, and I came into this field of entrepreneurship. And for the past 8 years now, I have been trying, and I think this path of trying will continue for my whole life to establish dental genetics as a domain in India as well as abroad, and giving a very good pathway, career pathway to the people who are upcoming and who are already existing in their any career level. Yeah, I think that was a very long answer for your question.
Yeah, I think, but it was really good to know. I mean, like, this is very inspiring to see a person who has been pursuing research or has been into the field of genetics, and because your core area or your research involved around oral cancer, and you wanted to know more about oral cancer, that's why you pursued BDS. So I think that's a very, very inspiring thing that you did, and very few people would be doing this, of course. And to see these amalgamation, these two fields coming together, this is again a very upcoming, as you said, and a very emerging thing, and a great career pathway, you know, if people get to explore more, because there's so much to explore in dentistry if you get into the genetics of it, as you mentioned, not just oral cancer, even a lot of other things are very unexplored. So yes, absolutely correct. Absolutely. So, you know, as you mentioned now, what are the various courses that one can actually do if they want to get into dental genetics after BDS or MDS?
Yes, well, this again should not sound that I'm beating my own drums, but this is fact, and you can go and check it in the internet. So, well, if you tell me about courses that I already told you, as such, there is no formed precise course that gives you a to B transition. So I have been working in this project for the past I think almost 4 years, where I tried to gather and understand the existing pain points both in the academics and the industry. So with all these things, collecting all these data or all these experiences, um, I have come up with a fellowship program which is called as Fellowship in Dental Genetics and Clinical Research, which is starting in August this year, from 15th of August. It's a 100% online course, and this course addresses all the gaps that is existing. So it is not like a theory. I will here nobody is going to teach you what is DNA and stuff like that. It is completely practical based. It is more about understanding how you implement the clinical research areas into your academic research. If you want to pursue a career in the industry, like applying as a job as a professional, so how do you do that? If you are an individual person, you want to grow as an individual researcher, you get a it's just there is a blueprint where we talk a specific module which we have designed, which we call as oral healthcare research career blueprint. So we talk all these things in those modules. So basically, we give you a very step-by-step guide through this course, and you need to know that much what is required, because today I cannot tell, because that tomorrow, Dr. Shirin, you become a molecular biologist in overnight. It is not possible. So that we don't expect, because it is always about collaborating. Science will only grow when we collaborate. But how we collaborate, whom do we go and speak to, and what is the way that we do this networking? Even we are covering these aspects inside this fellowship. So that's why I always call it as in a practical based method, not only in terms of the techniques that we will be teaching. I mean the technical aspects, like the molecular techniques that you will be learning. But the main thing is that how to start, where to start, and after starting, where to go, and what is the end point, and how do I reach my end point. We cover in this course very, very subtle things, like even how you should email an unknown person, whether you are trying to collaborate for your own academic research, or you as a student you want to connect to a professor, where you want to, maybe you are an aspirant, you want to apply for your master's or PhD, whatever. So we covered these kind of things, because personally I'll tell you, I have made a lot of mistakes in my life as a student. So from those gatherings, I understood these small guidance are very, very important, because just one email can make or break. So I'm just highlighting these areas which are generally not spoken of, and these are not formally, we're not formally educated in any of the education system right from school. We're not taught all these things. So it is not about a soft skill thing that we're trying to say, but this is very, very relevant. So, through this program, you will, apart from whatever the science you will learn, you will also learn these things, how to become an independent researcher. If you are a clinical practitioner, then what do you do with your data? Because when it comes to dentistry, I have seen a lot of time that people say, oh, this is research, this is not my stuff, I just do clinical work, I love doing that. But my dear friends, what you're missing out is the data. Data is your treasure. Every day, if you are seeing even 10 to 20 patients, you have a lot of data, and just by churning out your data, you can actually do very good contribution to science. So this fellowship covers all these subtle areas apart from the technical knowledge, apart from the clinical research areas. So I can promise that this is one concrete course this is a beginner course, so it will give you a step-by-step guideline, and you can think of pursuing a career in this goal. Apart from that, if you ask me other countries, yes, I can mention here about University of Pittsburgh, but they are very, very specific. They work, their School of Craniofacial Biology has a fellowship course on this aspect. So even you can apply for that. They have, I think right now they have online mode also, and you can check their website that is there. And most of the other courses, it will be oral biology, MSc or something, but uh, that's kind of very vast area. What I intend through my fellowship course is that, see, if I give you a plate of too many stuff, right, you will not enjoy all the tastes. Every taste will not be enjoyable by you. But let me give you one or two or max three items so that you enjoy your food, you feel satisfied, and for a long time you remember, well, I'm very foodie, I'm Bengali, so I will always, my examples will be on food. So that's the basic idea behind creating this course.
That's amazing. That's amazing. And like I just want to know if somebody, many BDS graduates or MDS graduates, they also pursue courses in genetics, like general genetics, MSc
Right.
course in genetics. So, uh, how is your course different from these courses? Because I'm sure in when you say general genetics, it is like you're taught everything. And your
Correct.
course, because it is more on the dental genetics, so is it more on the dental part of the genetics
Yes.
only?
Yes. So that's a good question, Shirin. Basically, see, first of all, in India, as far as my knowledge goes, there is no course which has, I mean, when it comes to genetics or biochemistry or stuff like this, where you have an eligibility for a BDS graduate. That is unfortunate. Maybe my knowledge, my information might be outdated. If you have an updated knowledge, please do share about it. But in India, a BDS graduate cannot go and pursue a MSc in genetics course. But yes, there are certain interdisciplinary areas, like you can, if you go to some IITs and some interdisciplinary centers that have been started, where you can actually make a transition there. But then that also takes you to a different domain altogether. Because when you talk about any core science, because genetics is a core science, just like civil engineering is a core science. See, for example, I am trained in genetics right from my age of 18 or 20 years, when I joined my first undergraduate course in molecular biology. So how we cannot expect that training to be passed on to a graduate who has already understood the clinical aspects. They are trained in a different way. Their mindset is different. They won't be happy just by learning the technology. But what if today, if I tell you that, okay, you have a patient, you see them clinically, and you think that there is a lesion. I'm just giving a very arbitrary example. There is a lesion in the mouth, which from the clinician's eye, you think that it might have a potential, it might be pre-malignant, or it might have a potentially malignant thing. So now what do? You do biopsy. You do biopsy. That's the first gold standard that we have. But what if I tell you that there is more an adjunct that might help you to decide on the biopsy results as well. So can't you do genetic tests for this? Yes, there are other aspects that is irrelevant in this session about the cost or about the availability. I'm not talking into that aspect, but I'm talking about the possibility. So people are not aware of this possibility. So that things we are bringing up through this course. Second thing is that, as I told you before also, that you should know whom to approach, where to go. Okay, Dr. Gargi says do genetic testing. Okay, very good, very fascinating. Now, what do I do? How do I convince my patient, and which patient should I refer to? Whom do I go here? So, should I send my sample to USA? So many of calculations. Is this something is available in India? Let me tell you, there is a genomic boom which has happened in the last 5 years or so. India is one of the best hub for genomic medicine. So everything is existing through this fellowship course. This is different because it doesn't take you away from what you have learned already. It just helps you to make additions, because even if you are doing clinical practice and you really don't want to get into hardcore research, that's okay. But if I tell you, okay, so and so company, you can go and approach them, you can collaborate. So as a clinician, you can just pass on the sample of saliva or a tissue or whatever they ask you to pass on them. Make That's a good decision for your patient also. Earn some revenue as a commission from that company. So it adds revenue to your practice as well. So these are certain areas which I personally, that's why I told you that I have worked on these 3-4 years, because launching a course is not a big deal, Shireen, today. Tomorrow, you and I can go and just speak about something and we can ask money from people. And I know that there are a lot of interested people. There are, hungry minds which are existing. But it is not about taking the money, it is about the benefit that you give through your knowledge to a person. They should be able to harness, or they should have maximum ROI, that is return of investment from what they have invested. So through all these experiences or researches that I have done, this course makes you different, makes it will place you at a different level altogether. Even as you mentioned, just I'm extending my answer if that is okay for you. As you mentioned about fresh graduates, many graduates, as you said, they try to pursue courses, even they want to go abroad. See, when you start your application for abroad, okay, at least 1.5 years is required if you do it diligently, right from giving all the examinations like GRE, IELTS, or whatever is required. Then from starting the application, then getting admitted, getting scholarship or funding is another very big question. Now I'll tell you the as far as my experience and knowledge goes about the methodology, how these universities work. They will always prefer a student as a candidate who need not be a gold medalist, or they don't expect you to score 100 900 or 9 out of 900 or 100 of 100 in a GRE, and you don't think if you even score, you might not be a correct candidate whom they are taking. But if you have a preliminary knowledge, a preliminary experience in what you are trying to pursue, then you will be a preferred candidate. Like for any PhD course, even in India as well as abroad, there is something called as a coursework. So that is nothing but the universities, the industries are spending money behind the student to train them so that they can make them work in the project. So why you will be preferred when you have this kind of a knowledge priorly? Because they see, okay, this person is okay because they already have the basic knowledge, they have the basic training. So in this way also, this fellowship course will help a student in attaining or getting admission in the whatever their aspirations are, if they want to go into any other interdisciplinary course or inside the core sciences. So this fellowship actually equips you with all the skills and knowledge that is required, and you will not be you will not feel out of place when you go abroad, because Indian education system is quite I don't know, I should speak on a public forum like this, but I am a very straightforward person, because we don't encourage interdisciplinary. If you go and see their system, if you are a biology student or you are a doctor and you just like psychology, you can just take up a course in psychology. But Do we have a provision here like that? We don't have. So there is a basic difference. But let's not talk about, or my idea is that let's not complain about everything. Let's just make a solution to the problem. So I think this fellowship is a solution to all the existing problems or gaps.
Correct. Absolutely correct. So, like you said, these courses, this kind of course is also available outside India, and somebody wants to pursue it from, abroad. Then, what are the factors that one should keep in mind while they're choosing a course or while they're choosing a college or university?
Yes, that's a very good question. First of all, when for not only I'm talking about my course, for any course in the world, whether it is online, offline, see, you have to understand what is your interest. You have to first understand that, because I have seen things that most of the time we think that, okay, after doing this course, what job I will get. That is very important. But you should also know that whether you will be really interested to do this, because Shirin, I have seen during BDS, I was really surprised. There were students who give continuously, they studied and they used to give supplementary exams for 10 years. They are studying BDS. Why is it required? That person is not interested. Pull them out and let them do a business. They will do better in life. So when it comes to choosing the right course or how to choose a course, first thing that you see, two things. One is whether you are interested in what is your end goal that you want to achieve. These two are the most important points that will help you to make decision about the course. Second, go and see inside the content, because most of the courses, they will give you an idea what will be covered inside. Read thoroughly about the modules or about the subjects that they are covering. Third, if possible, connect to a administrator or academician or a person who is teaching the course if it is possible. So you can always do that because emails are available in the website. So talk to them, and first of all, before talking to them, also go and see what kind of paper they are publishing, what kind of work is exactly going on. So this is, I'm talking more in perspective, like as a student, if you want to pursue a particular field. Particularly, this is more for higher studies. Suppose if you're going for MSc, if you're going for PhD, again, I stress on this. What is your end goal? Are you satisfied by doing a job? Will you be see yourself 5 years from now? Have that long term vision before you select a course. Because, like for me, I will not be happy with a job because I'm entrepreneurial by nature. So I will always love to do something which I create of my own. So there are many people out there. So then you see that the course that you are entering, does it give any insight to that? Or maybe it might be a first step towards entrepreneurship that you want to achieve ultimately. So these are the kind of things that you should see. I have a YouTube channel which I run, which is called as Edupreneur by Dr Gargi Roy Goswami. Well, I have a very limited subscriber because I always believe on quality rather than quantity, because I speak about very niche areas there, as genetics and saliva and stuff like that. So I have made a video on how to choose a right course. So yeah, you can just your audience can go and watch that as well, because I have given you there the step by step, some 3 or 4 steps with which it will help you to exactly decide how to choose any course in that matter. Yeah.
Correct, correct. And I've seen your, videos, and that is how I came to know about dental genetics and about this field and the amazing work that you're actually doing in this field.
Thank you so much.
So, all your audience out there, I think you're getting inspired from what the conversation is all about. It's a very, very emerging field, a very new field, and many of you, as you want to get into the research, I think this field can actually help you to get into that research. But as she mentions very correctly, it is very important to understand what is exactly your area of interest and how do you see yourself 5 years down the line. Basis on that only, go for any kind of course that you would like to do either after BDS or MDS. So how do you foresee, I'm sure as the field itself is very emerging, it's very new thing in the market. So, but still we would like to know, how do you foresee the future in the field?
See, genetics and genomics, I will not call it again future at this moment, because that future has started. I think I don't know if you're aware of something what we talk as personalized medicine or stuff like this. What exactly is this? This is something which is like a tailor fit, custom made fit, treatment procedure. And that's the future, because the way the entire treatment world is going on is just trial and error. Because it's very simple, like, you take a drug, I take a drug with the same symptoms. Then why, how do we blame the drug? Is it the efficacy of the drug that is not good? What is the reason that it doesn't work same way with you and with me, though we clinically we show the same symptoms? And I think as a clinician, this is something every day we observe these kind of things, right? So when it comes to genetics or genomics, India has become a genomic medicine hub. And if you want me to mention the cities, one is Hyderabad, then comes Bangalore. Okay, so there is a lot which is happening. And why I became passionate and I have left everything, and you can tell that I have dedicated my life to this dental genetics, because when I see that the other medical fraternities have taken up, not only taken up, they have advanced in this field so much, but why we should be kept isolated? We are see, the one thing is that there is lack of education, but I think that's not a big deal. You can always learning never ends. Second thing is that it is all about knowing and getting awareness. So if you tell me the future, this is the future. And just to mention and just to validate what I say, if you know something about Human Genome Project, it is one of the milestone scientific attainments that has happened in the scientific world. So basically it is understanding, sequencing everything what is present inside our DNA, which you also have, I also have. So this project was a very big project that has happened and it was completed, but still there were certain areas of human DNA which were which was under the dark. And recently, I think last year, the entire thing is sequenced. Okay, so we know how many disease genes we can have. So that means what? We are going into more specific targeted solutions. I'm not telling that tomorrow if you ask me, okay, Dr. Gargi, what is that test I can do chair side? It is not available at this point, but who will do it? Somebody has to do the work. So this is the thing. If young people, the young generation take this forward, then definitely the face of dentistry, at least in India, is going to change a lot, and also globally. Second thing is that when it comes to medical genomics, if you see breast cancer area, or take up any kind of critical diseases, everybody talks about genomics. They are doing a lot of things, but where is dentistry standing? So in this way, this field is just like an open field, and more faster you get into this field, you will love it. I can guarantee you, I can write and give my signature. And because this field has started growing, and even in India, the Indian government has now looked, I was very grateful when I saw that news, because now Indian government has started this Indian Genome Project. This is because, in India, we are very, very varied people. Each state is a different population. There is no match. So there is a lot of diversity. There is a lot of news information that can come up, and we can slowly bring up tailored, medicine. Because in Hyderabad, as I said, that genomic medicine counters are there now, like we have normal drug counters. So there is a lot that is happening. Only dentistry has to just come on track, and if they start knowing, I'm very sure that the scenario in the next 5 years is going to change a lot. And I think we can crack the dreadful diseases like oral cancer. I mean, that is because for the past 2-3 decades, so much research is happening, but we don't have a single point solution to that. So these basic questions we need to ask ourselves: why it is not there? What's going on? Because what's happening in the Western world, those studies, that data we are sitting and reading, and we are trying to replicate or something, but it will not work for the Indian population always. It is very, very diverse. So once you get into the you know these technologies little bit, you know how to collaborate with people. As I always say that my mission is not to make a dentist pull out from their interest place and make them a molecular biologist or geneticist in the next day and tell them don't forget your dentistry, just do this. No, but you should know how to bring this together to your advantage as a career, as a student, as a clinician, as an independent researcher, as an academician, because that is very, very necessary, because institution academics, they pull up a lot of data, and how we can play with this data and use it in a better way. So as a future, this is a very, very promising field. And as I gave you some validating points, you can go and your audience can also go and check about what I'm talking. So there's a lot to do, actually. It's just a start.
Right, correct. So you've already answered my next question in terms of, I was about to ask that what are the various opportunities or avenues that open up in genetics, but since you mentioned
Yes.
like one can work as a independent researcher, they can also even the practicing dentist can actually collaborate with all these laboratories which are there, and they can side by side do this kind of work, and also one can work or have jobs in the clinical research area.
Right.
But I just wanted to know more on the aspect, like somebody who really develops an interest of getting into pure research work in dental genetics. So how do they go about it? How do they get the funding and all of those stuff?
Yes, that's a good question, Shireen. Actually, I also wanted to give it addition with all what I've mentioned regarding the career part. So there's something called as bio entrepreneurship. Like, for example, you have seen that you might have seen that people come up with many innovations. So about the funding. So I'm not talking about all the things right now because it will be a very, very long conversation then. But to talk about in India, Government of India, there is something called as BIRAC grants, that is run by the Department of Biotechnology, DBT or DST. There are a lot of small grants, even ICMR. I hope many of you know that about ICMR. Even at the student level, they have something called as I don't remember the full form of that, but there's something called as STS grant, which is specifically for students. If you are an undergraduate, postgraduate, you can apply for that. So you also learn that process, go through that process. It's okay if you fail, but that's okay. But this kind of things are existing. Apart from that, also there is something called as incubation. So most of the universities, even most of the IITs, most of other government organizations, even contract research organizations, they help you to collaborate with them. They help you to mentor you if you want to bring up your innovation and take it to the next level. Next day you want to bring it as a product, whether it is an app, whether it is any appliance that you are doing, anything, I mean any innovative thing. So that process is called bioentrepreneurship. And incubation is something where with very nominal monthly charges you have to pay to those government organizations or semi-government organizations, and you can access high-end instruments. Because see, tomorrow suppose you are interested and you want to develop say a kit or some test, so you need a lab support. You just cannot open a lab and take all the license and then you do the research. By that time some 100 researchers and you will see your idea is roaming as a product in the market. So this is something again we need to actually explore and understand. And just to mention that we covered this aspect as well in our funds and grant application module in the fellowship. So these things are very subtle, and if there is a procedure, you have to be, if you want to become a researcher, well, I always say that I mean it's Hindi, like you have to become, I mean jugar, you have to know, if you're a researcher, jugar and beggar, you have to have those attributes fixed in your characteristic, then you will become a very good researcher. Well, that was just a fun part, but yes, this is the way you can go ahead. And if any student wants to pursue, well, that's like the academic pathway, like you go to the next higher level. You can also you can also join some projects. So these projects, temporary projects, summer training projects, or some small 1-year projects that universities keep advertising in a very closed way. If you see their, if you follow their websites very diligently, you will come to know, and you can just apply. So don't let go any opportunity. Even if you see that there is no eligibility for a BDS, please apply. This is my suggestion. Because when I got into JNU, I never thought I'll get into JNU. There was no eligibility or experience they asked, because I was just a postgraduate that time, and I had qualified GATE that time. I was a fresher basically, but I applied and I cracked it in one go. So I'm not trying to boast about myself, but I'm just trying to say that whenever you see a possibility, just don't judge, you take that opportunity. That is what I'm trying to say. Yeah.
Yes, absolutely correct. And I think that's the only way that one can actually learn also. You learn a lot of things from your own experiences. So yes, absolutely correct. So I also, out of curiosity, I just want to ask, since you mentioned that your course is purely online, but if
Yes.
somebody wants to learn the technical side of it, like I'm sure you would be having a lot of collaboration with the laboratories available. So if somebody wants to learn those technical aspects, like how a genome testing is done or how does a lab looks like, do you also provide those kind of exposure to your students?
Yes, actually, Shireen, I used to do workshops before the pandemic, which were offline workshops. But at present, after the pandemic, during the pandemic, we couldn't sustain that model. In this particular fellowship, though we do not have that you go in person and learn, but in this fellowship, you will be trained. The content is such that it will be like a virtual lab mode, and the exercises or assignments would be so creative that you will feel like that you are exactly doing that job. Like for example, here, just for an example, we will keep small project, the assignments will be projects as well, which can be done online. Like for example, here you will get exposure to more about the dry lab, that is the bioinformatics part. So it will be very interesting. So basically, when we design even in the wet lab, we first need to design it in a dry lab, and then we replicate it in the wet lab, so that is how it goes. So at this present moment, in this fellowship course, we do not have a provision of getting physically into somewhere, but yes, definitely I'm looking forward, and maybe I'll come up soon with the offline workshop, or there might be an addition which is in our cards, but we are just working on it at this moment. Yeah.
Okay. So how has this pandemic impacted the field? Because I'm sure there were a lot of oral issues also that had happened because of COVID-19. So is there an impact of COVID or pandemic in the field?
Particularly in the field of dental genetics, if you say, well, it is just like any other field. And when it comes to research, it has definitely impacted a lot, because research is always about yes, harnessing knowledge, but when you really do it practically, you need samples, you need to sit inside the lab, and you have to work day in and day out. So sample collection was something which was very difficult at this pandemic time, which I have seen among the student groups, even MDS or BDS people, or even the basic sciences researchers. But I think the dry lab part, like the bioinformatics part, went well, because there you really need to just play with the databases and finding out things. So I think that way it hadn't impacted a lot. But yes, as all other industries got impacted, research got impacted globally, because fundings also went low. Many researchers had to stop their research. That is also there. Yes, but I think it has a positive side also. As I said, that I used to do this workshop mode, like dental genetics workshop, or on saliva, where I used to teach the techniques and you come in personally. So I used to do in that mode. But what I see the positive part, that I started certain courses like oral cancer genetics, dental genomics, saliva, and to be very honest, that time in 2020, I just thought that I have to survive, I have to sustain as a business. Very forward, I'm telling you, because those physical collaborations were not working, because projects has to come now. Students are not coming to institution, where from research will happen, and where from your project will happen. So that time I thought, okay, let me just at least let me make people aware, and let me see if this works. So I started online course like oral cancer genetics was one of the course which I personally felt nobody will come. But because, seriously, because I thought that, okay, people learn so much about oral cancer, what else, they might not be interested, but let me see if it works. And till date, that is one of my best signature course. I prefer to say that. So why I gave you this example, because I saw that that time people were stuck so much. They were trying to survive this this restriction of being closed, and that gave a positive aspect of opening your mind towards learning new things. Another thing happened is that with technology, with internet, everything, it suddenly there was a big boom, because initially people were skeptic, at least Indian mindset. I know that like I do a conference every year on saliva from 2019. So in 2020, I personally got criticisms because it was a physical conference. I did it in IISc Bangalore. That is one of the premier research institute in India. But what happened? Some of my international speakers, they couldn't make it. So what I did, I made them live online lectures. So I got quite a lot of criticism that time in January 2020 that the speakers are not coming, why it is online. But we never knew that within some 10-15 days the entire world is going to change. So what I'm trying to say is that the positive aspect of pandemic in any field, and particularly in this field as well, is that it has made people adapt to this online mode of learning. And now if you see, people have started preferring this mode, until unless, yes, if it is a real hands-on thing which like clinical case that you want to do, yes, you go physically. But when it comes to harnessing knowledge, this gives you more flexibility, and particularly when it comes to self-paced learning, or even live sessions where you just go and sit in your own house and you attend, and you see the recordings and you can see it repeatedly, which is not possible in any physical classroom format. Lecture finished, that's all. How much ever you could grab, or you are not allowed to record also. That is not the very good, that's not taken as a very good norm before, I'm telling. But this is the positive part of the pandemic, which I see overall. Yeah.
Correct, correct. And I think the pandemic has also helped us to learn that, apart from having your primary source of income, it is important to have a secondary source. So people
Absolutely.
are now learning, and they're going out of their ways to learn and adapt, and whatever they can do so that they can actually have a second source of income. If tomorrow, you never know what if another pandemic, hits us.
Absolutely.
So yes, correct. So all your audience, I think this is a very, very promising field, as she has mentioned. It looks like you can actually pursue a lot of things, and you can pursue a lot of researches within the field of dental genetics. So if you're one who are interested to pursue this field, go ahead, talk to Dr. Gargi. You can always connect to her on her LinkedIn, on various social pages. She has designed a course specifically which fulfills, or which makes sure that the gap between genetics and dentistry is filled. So if you want to know more about this particular course, you can always connect back to her through various sources. All the relevant links I will be mentioning in the video description, so do check that out. So lastly, Dr. Gargi, what is that last, or what is that promising advice that you would like to give to our audience?
See, I think that I am not eligible to give an advice, because first thing, that I find myself always as a learner. So for me, learning is lifelong. This is what is in my belief system. What I can do is I can just suggest. See, there are two things. If you want to follow your passion, you have to leave your comfort zone. And this is not my saying. Any people who has done this will say you the same. But again, I want to add here, you don't have to be always uncomfortable and then achieve a goal. My point is, I always say this: whatever you have at hand, whatever resource you have with you, just tickle your mind and see that what you can do out of it, what you can make out of it. Because that is something where always we think that to start something new or to harness something new, we need money, we need knowledge. everything is existing. But I personally feel, at least through my own career pathway, money is not the primary thing that you need. You need patience, you need perseverance, and you need consistency. So it is not PPE, but it is PPC kit that you need. And that's the mantra of success, which this is my individual perspective. So consistency, patience, and potential. Because sometimes we are not aware of our talents as well. As Shirin, you rightly said that now people are trying to harness different areas. And I personally, I thought that, okay, I could never think that I can design a poster, but I do it well now. I mean, I'm just beating my own drums that way, because as an entrepreneur, I have to save a lot of, I think, before I spend, so every penny matters. So for everybody it is like that. So yes, so that is one suggestion I can give you. So always carry your PPC kit with you, and that's all. Life is very simple, we just make it complex.
Right, absolutely correct. And as you really mentioned, it is very, very important. We had so many, almost like now 60 videos we have, and every industry experts comes and says the same thing, that you have to be patient, you have to be consistent, you need to realize your potential, and you will
Yes.
definitely grow or achieve whatever you want to do in your field. So yes, absolutely correct. And thank you very, very much, Dr. Gargi, for coming on our channel and talking about this particular field. This is, I think, a very hidden field, very unconventional field. And it will be great if people can actually explore, and even if one person gets inspired by our conversation today, I think this field is going to go very far. So thank you very much.
Thank you. And I think, Dr. Shirin, you are doing a great job, because I think this kind of insights from different various aspects, what people, or particularly freshers, they can do, because that's the point where we have a lot of confusions. We really don't know what to do and what not to do. And I think with your channel and with your other services, you are doing a wonderful job. Thank you for having me here today. Yes, it was wonderful.
Thank you so much. Thank you so much for all the appreciation. And all you audience, thank you so much for patiently listening to us today. If you get inspired, connect with Dr. Gargi and get things going in this field of dental genetics, because this is a very, very promising field, as the conversation is already unfolded for you. So thank you very much. I will see you in the next video. And before that, please subscribe to our channel, like and share this in your network. This might help out somebody who wants to get into the field of research or clinical research. So thank you once again. I will see you in the next video. Until then, bye and good luck.